And once again, welcome to my IT channel. Today we will have another one role play card. This setting is hospital and the procedure is endoscopy and the condition is gastroesophageal reflux disease. So we can see the card. They have given one information. This information is very much important for you to start the conversation and to know about your position and to know about to whom you are talking. So always don't miss the task what they have given to you. Before going to the exact task, before task they will give a note, so you can concentrate over there. You can see that here they have given a 55-year-old patient is scheduled for an endoscopy to investigate his or her gastroesophageal reflux. He or she wants more information. So in this scenario, you can come to know that he is going to undergo a procedure and he wants more information. That doesn't mean that he came for the procedure. That means he came or she came to get some information regarding the procedure. That's all. That is the first thing. Okay. So how we can start? Good morning. My name is Rashmi Rajan. I am one of the registered nurses working in this hospital. How may I address you and how can I help you today? So that is the first greeting from our side. The next thing is find out how patient feels about endoscopy. Actually, we are going to ask about this thing before that we have to give the introduction. Then the answer from the patient will be, good morning sister, my name is George. Actually, I came here to know something regarding endoscopy because my doctor told me to undergo this procedure in these coming days. Then we can tell that, okay, Mr. George, no need to worry. I am here to explain you. Before proceeding further, may I know how you feel about endoscopy procedure? That is our first task. The next task is give information about endoscopy. Regarding the endoscopy, they have given that short duration. It is 15 minutes, and the sedation, like local anesthetic, throat spray, very little pain, some discomfort, etc. And explain the preparation needed, like no food after midnight, only clear liquid before 6 hours, and find out current medication details because they have given multiple subtasks here. Then for our question, the patient's answer will be, sister, actually I don't know anything regarding this procedure. That's why I'm somewhat worried about this upcoming procedure. So could you please explain me in detail? So our next task, the second task will be like this. No need to worry, Mr. George. I will give you some information about this endoscopy. It is nothing but it is a simple procedure to analyze your gastrointestinal tract, and it will take only short duration also, that's 15 to 20 minutes. In this procedure, at the starting time itself they will give you local anesthetic spray over your throat so that you will not feel any pain at the time of procedure. But after the procedure, maybe there will be only little pain or some discomfort will be there. Sorry, getting my point? Like that we can ask. Then we will continue with that. And I would like to inform you regarding some important preparation which you need to take before the procedure. That means please try to avoid food after midnight. Only clear liquid you can take before 6 hours. So that is nothing but to prevent some complications during the procedure and even after the procedure. So are you okay with that? Like that we can tell. Then find out current medication also. And we can ask that, and I would like to ask you one more question regarding your current medication details. Are you on any medications or do you have any chronic conditions? Then the patient's answer will be, no, I don't have any other conditions and I'm not on any medications. And we can tell that, oh, I'm really happy to know about that. Then the next task is explain needed for fasting because of risk of aspiration under sedation, ensure good view and find out any other concern. This is what we explained already. Then we can tell that for your further information, I would like to stress the importance of fasting. Please try to keep fasting before 6 hours because as I informed you, there will be risk of aspiration because you will be under sedation. And moreover, for good view, the food particles, if it is not over the area, will be highly beneficial. So I am strongly recommending you to follow the fasting requirements. So do you think you can do that, or how does that sound? Like that we can ask. Then the answer will be, okay sister, I can do that, no problem. Then we can ask, do you have any more concern, Mr. George? Then our next task is reassure patient about procedure. regarding complications. So the possible question from the patient side will be, sister, could you please tell me about the after effects of the procedure and any complications? Then here we can tell that, or maybe patient asks you, I heard many stories regarding the complications of procedure. Is it a very complicated procedure? Something like that. Then we can answer like this. Your questions are very reasonable, Mr. George, but no need to worry. This is a quite usual procedure in our hospital, and the complications are very rare. And I can reassure you that the complications maximum we will try to avoid, because there will be continuous monitoring before and after the procedure. And moreover, regarding the procedure and regarding aftercare, regarding the complication, the possibility of complications, how we will prevent everything, will be the information will be given by your doctor before the procedure. So no need to worry about that. You will get clear idea about the procedure from your doctor. How is that? How does that sound? Or is it clear for you? Like that we can ask. Then patient asked you about the post procedure also. So we can tell that, and I can address your question regarding post procedure expectations and regarding after effects. There will be only mild discomfort, and you can have the adequate rest before discharge. And I can tell you that it will be a quick recovery. You will have a quick recovery after the procedure. Once if you settled after the anesthetic effects, of course you can get discharged mostly on the same day without any delay. And regarding the after effects, I can tell you that there will be some side effects or after effects of sedation, like drowsiness. And as I told you, after when you will recover from this all drowsiness, you can go home. But I would like to inform you to get someone for getting you back to the home, because you will be have mild drowsiness, and driving will be somewhat difficult at that time. So if you get some of them from your home, at least your friend or relative, it will be easy for you to go back to your home. So are you clear with me? Then patient will tell that, yes sister, no problem, I can get some of family, some of any of family member, or I can get my son itself. So himself, he will help me. So no need to worry about those things. Then we can tell that, oh, I am so glad to know that your son will accompany you on that day. So nothing to be worried. And do you have any more concern to be addressed? Then patient side will be, no sister, it's clear. Thank you for information. Then we can conclude that, okay, Mr. George, I hope I have clarified all your doubts. Meanwhile, if you need any clarifications, please do not hesitate to contact with us. This is our contact number. So nothing is there to be worried about your procedure. It is a safe procedure. And if you need any clarifications, you can contact in this number. Thank you for your visit. Have a nice day. With that, we can conclude the conversation. So in this conversation, mostly what you have to keep it in your mind, it is a two-way conversation. Actually, always we will have the card with a two-way conversation. It is not a single way conversation, or it's not a monologue. So what is the thing? You have to include your interlocutor also. In between, you can ask them, do you have any concern? Then they will ask you the second task or the next task. So equally, you can have the conversation with the interlocutor. So only from your side, if you explain, it will not be good presentation to get B score. So always keep it in your mind to include interlocutor by asking, do you have any questions? Do you have any concern? Are you clear with me? Is there anything to be clarified? Is there anything to be addressed? So like that, you can ask in between. Then at the end, again you have to ask, is there anything to be clarified? Then if you don't have any other questions, may I proceed with procedure, or may I fix the schedule? Or if you don't have any other question, please keep this contact number with you. You can contact me anytime if you need any clarifications. Like that, the conclusion will be different for every role play cards. So according to the conversation, according to the task, please try to make the introduction and a very good conclusion. So your role play will be very much effective to get B score. I hope it is clear for you. We will see with another one informative video. Until then, bye. Take care.
Artlist.io